Hi, dear friends. I'm Dr. Sanjana from SIAHMSR, and today I'm here to discuss with you the importance of kalmia latifolia, mountain laurel, in neuralgias. Neuralgia, especially of spinal origin, is the topic of discussion today, and kalmia latifolia is used chiefly as a heart remedy, a remedy for palpitation, a remedy for dyspnea, exertional dyspnea, tachycardia, and rheumatism metastasis into chest. And we can use it as a remedy in neuralgia of uterine origin, especially dysmenorrhea. And kalmia latifolia as a remedy for spinal diseases, radiculopathy, cervical radiculopathy, is the topic of the day, because I'm very much interested in spinal disorders and its treatment, and my focus on kalmia today is on its role as a remedy for spinal diseases. Kalmia is useful as a remedy for neuralgia originating from thoracic region, upper thoracic vertebrae, T1, T2, T3, and the pain may be radiating to the shoulder, scapula, and down the arm to the hands. Kalmia is very much useful in weakness consequent to spinal diseases or disc bulge related to thoracic region, upper thoracic vertebrae T1, T2, T3, and I have found it very much useful in cervical radiculopathy also. In my clinical practice, I will share one example of that kind, and it's very much useful in cervical radiculopathy originating from C5, C6 vertebral level, and C6 spinal nerve was in problem, and there was inflammation consequent to disc bulge, and there was no osteoporotic findings in the case. There was no impingement, but the inflammation consequent to disc bulge or disc herniation caused severe pain in the forearm and hand of the patient. The patient was an adolescent boy, and his major complaint was weakness of hands, both hands. It was a bilateral complaint, and there was tremor also. He had consulted many ortho surgeons in the area, but the main problem was tremor. They were considering it as a psychological problem, but actually it was consequent to the nerve irritation in the C6 spinal nerve and its pathways down the arm, and the patient had no arm pain, but he had shoulder pain. As I described earlier, there was pain in the scapular region, especially on the left side, and he was not able to raise both his arms. Abduction was not possible in this case, and there was pain, severe intense pain in the forearm and into the hands, and tremor. He was resting tremor. So I chose kalmia as a second remedy. The first remedy I had given to manage the case was hypericum, and followed by that I gave kalmia 200. Kalmia 200 cured the case. It was not a single dose. I repeated kalmia once in 3 days. Kalmia 200 is very much useful in radiculopathy consequent to cervical disc bulge. Also, it's useful in thoracic disc bulge also. In that case, the symptomatology is a little different. In thoracic disc bulge, the pain, if it is in the upper region, T1, T2, T3, the pain may be radiating to the arms and to the hands. But if lower thoracic vertebrae are affected, the pain will be radiating to the chest region. It will be presented, or it will be mimicking as intercostal neuralgia. In that case also, kalmia finds indication, and we can use kalmia for ordinary intercostal neuralgia, just like a normal intercostal neuralgia consequent to other causes. But in this case also, thoracic disc herniation and consequent intercostal neuralgia, we can use kalmia. Kalmia is useful as remedy for dysmenorrhea and facial neuralgia also. It's generally a remedy for nerve irritation and nerve inflammations and consequent pains, and it's a remedy for right-sided complaints more. In the case, as I told earlier, there was weakness of the right hand, and there was weakness of muscles consequent to C6 spinal nerve irritation, and kalmia helped to recover from the cervical disc bulge and consequent ailments. So that's all about kalmia in neuralgia. Thank you for watching.